Hello everyone, I am Ritu Sani. Today I am here with my torso model. On that, we will revise our anatomy according to the visceral organs placement in the cavities. And we know that this is the ventral cavity and posteriorly this is the dorsal cavity. In this ventral cavity, we can see that the thoracic cavity, abdominal cavity, and as well as the pelvic cavity. So these three cavities are in the sequence. And in the posterior side, where the dorsal side, we can see the cavity which is related to the cranial cavity and the which carrying the spine, that is the spinal cavity. But now today, as we are moving towards the ventral cavity, so today we are seeing about that how the organs placement in the ventral cavity according to the placement of all the organs with their functioning, how they affect function versus dysfunction of if they are in the disorder. So this is the way we are moving towards. Like in this you can see that this is the brain, and this is the, although it is in the dorsal cavity, but we know that there is a part of the brain, cerebrum, cerebellum, and this which is, and the spinal cord is coming posteriorly. But anteriorly, what we are seeing in this ventral cavity, there is the related to the part of the pharynx, the nasopharynx, which is related to the nose, oropharynx. Then we are moving towards this part of the larynx, that is known as the voice box. So this is all. And after that we are having a thyroid gland, and after that we are having the rest starting of that particular area of trachea, which is moving in the lungs, that we will see in next. And this is the outer side where we see that is the sternum, that is already with in the thoracic cavity. We understand about the functioning of the sternum itself, and these are the ribs which is attached. So these are, there are ribs which are in downward, there are the ribs which are the floating ribs, so they are not attached to the sternum, so they are attached here, so you can see it there. And if I will remove it, this covering, in this you can see that how the placement of sternum and all the ribs in between, there is a internal and external costal muscles, which also plays a very important role while we do the inhalation and exhalation, because they give the elevation and depression during the inhalation versus the exhalation. Then we are seeing that this is the trachea which is coming, and it is going to divide into the lungs. So both the side, this trachea divide into the both the lungs, and further the division of the trachea, it gives in the primary, secondary, and tertiary bronchi tree, it is going towards. And after that there is a alveoli where the gases exchange take place. So you can see it that these are the low lungs, and this is the right lung, and this is the left lung. In this you can see that the lobes, there are the three lobes, and here is the two lobes. And the shape also, you can see that why this shape is different from this lung, because of the placement of the left side, there is a pericardium, there is a heart. So for giving the space to the heart in the mediastinum, so this lungs taken the shape like this curve, so this is giving the space to the heart. And these are the lungs where the gases exchange is going to be happen. You can see that the trachea division with the bronchioles to bronchi, and in the last there is a alveolar where it takes the gases exchange with this pleural viscera. So this is the way you can easily understand. This is, there is a visceral viscera, first there is a pleural viscera, then there is a pleural cavity, and there is a pleural viscera from where this gases exchange is going to be happen. So these pleura gives the shock absorption, because there is a pleural cavity where is the fluid which gives the absorption, shock absorption to the organs when there is something injury or there is a fall. So that gives the absorption to the visceral organ and give the protection to these visceral organ through this pleural cavity. And there is, you can see that there is a heart, this is known as the pericardium, and the space in between, that is the mediastinum space. And after that there is a diaphragm also, you can see in this, there is a diaphragm which also plays a for the breathing. We know that the diaphragmatic breathing is very important. When we inhale, so how the in during the inhalation, how the diaphragm going into the flattened position, and when we exhale, how it is comes into the dome shape. So it gives also the space to the organs which are below the diaphragm and the organs which are above the organs. And because of these inhalation and exhalation, these lungs do their proper working, where there is a lobe, apical lobe, mid lobe, and the lower lobe of that particular lungs, that plays a very major role. And their attachment to the first primary muscles, respiratory muscle, that is the scalene muscle. These are also plays a role in the respiration. And the muscles which are in the this lung, there is a on the pectoralis region, there are also the muscles which are pectoralis major, plays a very major role for the respiration. So with the lungs, these all muscle, the scalenes, diaphragm, they also are the part of the respiration. Then we are moving towards the liver. After that, lungs and the pericardium, because in this also we know that the heart, there is a two ventricles and two auricles, which plays a very major role. And there is a superior vena cava and the aorta, which also carries the blood circulation with the pure versus the impure blood which is they are carrying. So this is also very important part. And then we are moving towards the liver. And liver is also a very important part for the metabolism. We know that how the liver plays. And the liver is also, because of the presence of the liver on the left side, so there is a lung is little bit higher because of the placement of the lungs. And then we can see it, if I will remove it, you can see this is the heart. I have shown you that ventricles and the auricles, you can see it very clear, and how these blood supply is coming with the pulmonary aorta. And this is the liver which I have removed now. And you can see that there is a gallbladder. So this is all attached to the posterior side of the liver, you can see it. And after that, we can see this is the stomach, because from posteriorly from the trachea, there is a esophagus, that is also, because we know that it is from food pipe, the esophagus is also coming, which is coming and attaching to the stomach. So this is the stomach, and the esophagus is attached to the stomach. And this is the full part of the digestive system, from mouth to stomach, with through the esophagus. And this is the pancreas. This is also a gland, which you can see that this is also in the posterior side. And this is the gland which takes a main functioning for the balance of the insulin. So this is also very important part, you can see. And after that, you can see with the liver and with the pancreas, here is the spleen, which is in the left side. And then we are having stomach. In this also, the small intestine versus the uh, long intestine, you can see that this is that part of the intestine, ascending colon, transfer colon, descending colon, and then posteriorly the sigmoid colon. So this is all takes place. And this is the intestines, small intestine, which also takes part in the digestion. So we can see it. And if I will remove it, this one, now we are moving towards the retro part, where the kidneys, the urinary system is situated in the retro posterior part. So you can see that this is the adrenal gland, and this is the inferior vena cava, which carries the impure blood from lower limbs, and it is taken towards the heart. And these two are the kidneys, right and left kidney. These are the adrenal glands, and these are the ureters which are coming, and they are going to inserting into the bladder. And after that, we are having reproductive organs, male versus the female. If there is a the female organ, so how the pelvic floor placement is there, with the posterior to anterior, with the rectum to the uterus to the bladder, how it takes place. And this is the pubis symphysis. And if there is a male, so how the penis versus the scrotum, all the female male organs are situated in the pelvic floor, with the attachment of the pubic symphysis, and in the posteriorly with the sacrum also. So this is all about the ventral cavity, which has divided. Now you can see that thoracic cavity, abdominal cavity, and the pelvic cavities. So these ways, they are also having their diaphragm, like this is the diaphragm, pelvic floor diaphragm. And there is a diaphragm which is in the neck. So this is also the diaphragm that is also give the stability to the body. So these are the cavities, ventral cavity, where all these organs are situated. So next we will see about the dorsal cavity, where the cranial versus the spinal cavity is present there, with their all the situation of that segments which are give the stability to the body. Thank you so much.